Hey everybody, welcome back to our series on ultrasound safety and patient care. This lesson explores the basics of ultrasound safety. We will discuss potential bioeffects, the ALARA principle, thermal and mechanical indices, and the actions sonographers can take to improve patient safety. Ultrasound imaging offers real-time, non-invasive visualization of internal structures that is, for the most part, very safe. But like any imaging modality, it comes with safety considerations. To discuss these various safety considerations, we should revisit the factors of power, intensity, and pressure. Power refers to the total amount of energy transmitted by the ultrasound beam per unit of time, measured in watts. Power is managed by adjusting output power settings on the machine to follow the ALARA principle. Intensity is the concentration of that energy in a specific area, measured in watts per square centimeter. Intensity is monitored by the thermal and mechanical indices on the ultrasound display. Pressure relates to the force exerted by the sound wave on the tissue, influencing mechanical effects on cells. Pressure is gauged by the mechanical index on the ultrasound display. Together, these factors determine how ultrasound waves interact with tissue, and understanding them is key to maintaining safety. These factors are monitored by the thermal index, or TI, and mechanical index, or MI, displayed on the ultrasound monitor. We will discuss these indices in more detail a little later in this lesson. Power, intensity, and pressure are typically interconnected in terms of their effect on the body, and they're discussed in terms of either thermal bioeffects or mechanical bioeffects. While these factors influence image quality, they also affect biological tissues. In short, higher intensity and prolonged exposure can increase the risk of thermal and mechanical bioeffects. Let's take a closer look at these two bioeffects. Thermal bioeffects occur when ultrasound energy is absorbed by tissue, causing an increase in tissue temperature. The degree of heating depends on intensity, exposure time, and tissue properties. For instance, bone absorbs more heat than soft tissue. Therefore, sonographers must be diligent in keeping the thermal index, or TI, at or below recommended levels while performing sonographic imaging. Sonographers must also be mindful of limiting the dwell time, or the time that the transducer remains in any one spot on the patient's body. Using the manufacturer's presets or imaging modes that correlate with the correct part of the body we're scanning can ensure the indices are balanced between power and image quality. For example, when scanning a fetus in utero, use an obstetric scanning mode instead of an abdomen setting, which commonly has a lower power rating. Mechanical bioeffects are caused by the pressure fluctuations in the ultrasound wave, which can lead to cavitation or bubble forming, causing mechanical stress on tissues. Ultrasound waves interact with gas-filled microbubbles, which are created from sound waves, which will then oscillate and, at high intensities, potentially collapse, a phenomenon known as inertial cavitation. This can be dangerous. For instance, cavitation occurring near small blood vessels could cause vascular endothelial damage or microvascular rupture to happen. To reduce these risks, sonographers must balance image quality with patient safety, making adjustments in output levels as necessary. We do this using the ALARA principle, which stands for as low as reasonably achievable. This means using the lowest power and shortest scan time necessary to obtain diagnostic quality images. There are 3 essential steps to applying ALARA in practice. Select the right transducer. Higher frequency probes provide better resolution but may increase intensity and energy absorption in superficial tissues. Optimize settings. Use the lowest possible output power that still provides clear images. Optimizing settings should also take into account patient-specific variables like age, tissue composition, and pregnancy status that can impact susceptibility to bioeffects. Limit exposure time. Perform efficient scans, avoiding unnecessary dwell time on one area. Limiting dwell time is especially important for fetal ultrasounds. Longer scan durations increase the potential for thermal effects. Finally, to practice safe scanning, sonographers should regularly monitor the key safety indices we mentioned earlier: thermal index, or TI, and mechanical index, or MI. Thermal index, TI, predicts the potential for temperature increase in tissue. It estimates how much heat might be generated by ultrasound absorption, especially in areas with less blood flow, like bone interfaces or the developing fetal brain. Higher TI values indicate a greater risk of thermal effects, so sonographers must monitor and minimize prolonged exposure, particularly in fetal and neonatal imaging. Mechanical index, MI, assesses the likelihood of cavitation effects. It measures the potential for ultrasound waves to create or oscillate tiny gas bubbles in tissues or contrast agents. High MI values increase the risk of inertial cavitation, which can cause mechanical stress on cells and blood vessels, making it especially important to use low MI settings in contrast-enhanced ultrasound and neonatal lung imaging. The Food and Drug Administration, or FDA, and the American Institute of Ultrasound in Medicine, or AIUM, provide guidelines for recommended TI and MI levels for safe ultrasound use. For instance, the recommended TI for scanning soft tissue should be kept at or below 1.5, and the MI for general scanning should be kept at or below 1.9. TI and MI are displayed in real time on ultrasound monitors to allow sonographers to optimize their imaging while maintaining patient safety. In summary, ultrasound safety relies on the sonographer's management of power, intensity, and pressure to minimize potential bioeffects. Thermal bioeffects result from tissue heating, while mechanical bioeffects involve cavitation and tissue stress. Sonographers should follow the ALARA principle by selecting appropriate transducers, optimizing settings, and limiting scan time. Monitoring thermal index, TI, and mechanical index, MI, ensures safe ultrasound use, following FDA and AIUM guidelines.